Hi everybody, my name is Gina Matera and today I will be presenting my science highlight presentation and we'll be focusing on the high versus low carbohydrate intake on glycemic variability in gestational diabetes. So this is an outline of what I'm going to be talking about today. So first I'm going to start out with some background information on gestational diabetes and related terms just to help you understand the study. And then I'm going to go into some current research, and then we'll dive a little bit more into the study, specifically the methods, participants, and the results that we found. And then I'll do an overall summary of everything that we learned from the study. Okay, so before getting into the study, I just wanted to provide you with some background knowledge and a couple terms just to enhance your understanding of what the study is looking at. So first we're going to start talking about insulin resistance because gestational diabetes is defined by this. So insulin resistance is when your cells do not respond well to glucose and cannot easily take up glucose from your blood. So this means that your blood sugar will remain high, which is the term hyperglycemia. So like I said, gestational diabetes is defined by insulin resistance and a decreased glucose tolerance developed during pregnancy. So why is this a problem? Why are we talking about this? Because the prevalence of women diagnosed with gestational diabetes is continually increasing. And the prevalence right now ranges from 1 to 30%. It really depends on what country you're specifically looking at. And so when you have gestational diabetes, this can put the mother at risk for developing type 2 diabetes later on in life, and it can also make the delivery very painful and difficult, and then you can have a risk of the baby being born early or being born at a really high weight. Here we have some additional terms to help you understand what is being looked at during the study. First is glycemic variability, and this is the fluctuation in blood glucose levels. Next is postprandial, and this is a blood glucose level after a meal. And then we have glucose excursions, and this is the measurement of glucose excursions, which refers back to the fluctuation in blood glucose levels. So to help our understanding of why this study was done, I provided you with some of the current recommendations and then what this research is going to be looking at. So currently, gestational diabetes patients are recommended to consume a low carbohydrate breakfast in order to reduce blood sugar spikes. However, there has been some research, specifically with type 2 diabetes patients, that consuming a high carbohydrate breakfast with a low carbohydrate dinner is more beneficial on postprandial blood glucose levels. However, there's no research specifically for gestational diabetes and whether a high carbohydrate breakfast is more beneficial than a low carbohydrate breakfast. There's also no research currently on the timing. So our hypothesis right now for this study is whether to determine if a breakfast high in carbohydrates had a beneficial effect on fasting blood glucose levels, glucose control, and glycemic variability. Okay, so now we're going to begin looking at the study. First, we'll talk a little bit about the participants. In this study, there were 15 women with gestational diabetes who were at least 30 weeks pregnant, and 12 out of 15 ended up completing the study. 2 went into labor, and 1 was put on insulin therapy throughout treatment. For the methods, this was a randomized crossover clinical trial, and there were 2 independent periods of 4 days of a specific diet and a washout period in between. So out of the 12 participants, 6 were put in one group and 6 was put into another. And the first group that we're going to be looking at is the high carbohydrate meal, or this was also known as the breakfast diet. So this diet had a breakfast with a high carbohydrate meal in the morning and a low carbohydrate meal in the evening. So that is listed right there, and you can see the percentages for how the energy was distributed throughout the day. And then the second group was the low carbohydrate meal. So this group had a dinner diet with a low carbohydrate meal in the morning and a high carbohydrate meal in the evening. Both of these diets were isocaloric and had relatively the same amount of carbohydrates, fats, and proteins spread throughout the day. Okay, so now we're going to look specifically at the research article measurements and then the findings. So in terms of measurements, they collected a lot of data. However, I just really wanted to focus on 2 things that were critical for the findings and results, and that was the glucose levels and the fasting blood glucose levels that were drawn. So glucose was continually monitored for 72 hours in each intervention period, whereas the fasting blood glucose was drawn 4 times for a total of 8 since there were 2 intervention periods. And now looking at the findings. So starting with the high carbohydrate meal, there was a significantly higher variability in the glucose readings in the high carbohydrate meal as opposed to the low carbohydrate meal. So there still were significant bumps in glucose readings. However, overall, the high carbohydrate meal led to a stronger glycemic control. It actually dropped it from 4.9 from the beginning to 4.6 at the end, compared to the low carbohydrate meal, which started at about 4.9 as well and ended actually at 5.1. So after both intervention periods, those who were eating the low carbohydrate meal in the morning and the high carbohydrate meal at night actually ended up with a higher glycemic fasting blood glucose. And then it also was significant findings that the insulin resistance decreased in the high carbohydrate meal as opposed to the low carbohydrate meal. Okay, so now we're going to go into the summary and discussion part. And so basically in summary, referring back to the slide before, I noted that the high carbohydrate meal had more glycemic variability. However, there was better glycemic control. So this graph right here is actually showing the mean glucose comparing the 2 different interventions. And it actually shows that the glycemic control and the mean glucose was lower for the high carbohydrate meal compared to the low carbohydrate meal on average. And then also, like I noted before, the high carbohydrate meals decrease the insulin sensitivity while increasing it in the low carbohydrate meal. So moving forward, we really need to dive a little bit more into this because current recommendations are saying that patients with gestational diabetes should be consuming lower carbohydrate meals. However, this result is showing the opposite. So I think we need to dive more into that. And then we also need to touch more on whether having the large glycemic variations that were shown in the high carbohydrate meal, if they can cause more complications than having a consistently high glucose level. All right, that is the end of my presentation. I just wanted to say thank you for listening, and I also attached the link to the article in case you want to read any more about it.